When Diana Hyland was diagnosed with metastatic breast cancer in 2007, she was hoping for a miracle. Instead, she created one.
When we initially started the Miracle Fund, the vision was for university hospitals to become a destination for people that were in a bad situation with metastatic breast cancer. Instead of having to fly out to California or to Baltimore to Johns Hopkins, they could fly to Cleveland and get quality, top-of-the-shelf care.
Despite Diana's weakened condition, she worked tirelessly to make the first fundraising event a reality.
Well, she was somebody that had to stay busy, even in illness. That was her way of dealing with what she was going through. And she was involved with every phase of the event, down to the flowers, to the decorations, to the band. And unfortunately, things got very bad very quickly, but she insisted that this event continue on.
And while Diana passed just weeks before the inaugural gala, the night was a miracle in every sense of the word.
The first event we had was an outpouring of people. The entire Ballroom Shaker Country Club tents outside, the entire facility was filled up. We had people come from all over the country, and it was a very emotional event. It was a celebration of Diana's life. It was a great, great event.
Very first event, the total hit $500,000, and Ned was really bound and determined to get to $1 million as fast as possible.
We decided to keep it going beyond 1 year because it's something that she wanted. It was going to be her legacy.
For an event like this to continue on for 7 years is a testament to Diana, her friends, the support that she's gotten from the people that were very close to her. And I think she'd be very, very happy with the help that other people are getting right now.
Thanks to Diana's insistence, every single penny raised for the Miracle Fund goes toward fighting breast cancer. Today, that total is more than $4 million.
All of the effort that's been provided for and all the resources and funding from the Miracle Fund go to support our breast cancer research program. Some of it's used for genomic analysis, some of it to help us develop a new drug. All of it is designed, however, to help us understand metastatic breast cancer better so we can treat it better.
Dr. Lindsay Harris was selected as the inaugural chairholder for the Diana Hyland Chair for Breast Cancer. With the support of the Miracle Fund, she and her team of researchers are bringing new hope to patients with metastatic breast cancer.
As a translational researcher, I'm doing both clinical care as well as designing experiments in the laboratory and everything in between. We're in the genomic era, and it's simply a matter of time before every patient is going to have their tumor sequenced and have their own personal DNA sequenced. And so what we're doing here is developing programs so that we can take that information from the genome of the cancer and decide which therapy is best for that patient.
The impact of this research is touching the lives of people throughout Northeast Ohio and beyond, including cancer survivor Becky Hennessy.
The Miracle Fund really addresses an area that has not been addressed before, in the fact that metastatic breast cancer was really a death sentence years ago. And now, with the new treatment plans, with the new clinical trials and the new physicians that we're able to bring in, it really is becoming a point where we can live with this. The ultimate goal is to cure cancer, but in the short term really is to live with cancer. And I really think the Miracle Fund has brought us to that point.
7 or 8 years ago, we had a tiny little program in breast cancer research. Now we have a program that's nationally recognized. Without the Miracle Fund, I don't think we would have a breast cancer research program in the city of Cleveland.
As Diana would certainly remind us, the Miracle Fund would not be the success it is if it were not for the outpouring of support from their dear friends. Friends who have given their time and their energies to see Diana's vision to reality. Sadly, 2014 marked the passing of two of these very special people. Kate Caplan and Chip Corlett.
I want the world to know that Chip was an amazing person. He was a very caring and giving person. He had an amazing heart, unlike anybody I've ever known.
Chip will always be remembered as somebody who was larger than life. He had the compassion for anybody who needed his help. He was somebody that always reached out. He cared about his family and his friends, and he was fiercely loyal. If you're a friend of Chip Corlett's, you're a friend for life. Kate and the tennis girls were very instrumental in making sure all the assets of the Miracle Fund came together.
My mother's probably the most selfless person I've ever met in my life. There's not a person that she encountered that she didn't embrace and make an impact on.
Kate is warm, kind, giving, concerned, and just really special.
I know that her and Diana are now leaning on us even more and making sure that we gather more people, make them feel comfortable, and help them donate.
Thanks to Kate, Chip, and all the supporters of the Miracle Fund throughout the years, University Hospitals is at the forefront of discovery for breast cancer.
Breast cancer is one of the places where we've had improvement in survival. I think the future of breast cancer is very positive, and I like to be part of that change, increasing the chance that we'll be able to cure all breast cancers and eventually eradicate the disease.
On behalf of all of the patients who we serve at the Seidman Cancer Center and those who we have yet to serve in the years and the generations to come, I'd like to thank everyone for their support of tonight's event. Your support helps us to achieve our mission, which is to heal, to teach, and to discover.
I do have a personal passion with the Miracle Fund as a breast cancer survivor. The Miracle Fund has given me the life I have today and to be able to live a normal life, and the hope that people with metastatic breast cancer will continue to live a normal life. I really believe that miracles happen, and I feel that I'm living proof.
Thank you to everyone for your support of the Miracle Fund, and a special thank you to Ned for your vision, your support, your guidance, and everything that you do on behalf of University Hospitals.
Thank you, everybody. Because of you, miracles happen.
Thank you.
Thank you.
Thank you.
Thank you.